Introduction. Proctoscopy is a diagnostic procedure performed to examine the anus and rectum using a device called a proctoscope, a rigid, tube-like instrument attached to a light source and a lens. The procedure is also known as rigid sigmoidoscopy. Indications. Your doctor may recommend a proctoscopy to look for signs of disease such as hemorrhoids or abnormal growths in the anus or rectum. Locate the source of bleeding from the anus. Obtain a small sample of tissue for biopsy. Determine a cause for constipation or diarrhea. Monitor or remove rectal polyps. Screen for rectal or colon cancer. Preparing for the procedure. You will be given specific instructions regarding preparation for the procedure. In general, you may be asked to stop eating or drinking anything the night before the procedure and use an enema to cleanse your bowels. Avoid taking any blood-thinning medications as they may increase the risk of bleeding during the procedure. Arrange for someone to drive you home after the procedure. Proctoscopy procedure. Most proctoscopy examinations do not require anesthesia. The proctoscopy procedure may involve the following steps. You will lie on your side on the procedure table with your knees bent. A gloved, lubricated finger may be inserted into your anus to check for blockage or tenderness. The lubricated proctoscope is gently inserted through the anus and slowly passed into the rectum. Air may be fed into the colon to improve visualization. This may cause a slight fullness and cramping sensation, but you shouldn't feel any pain. Surgical tools may be passed through the proctoscope to remove a polyp or abnormal tissue. Once the examination is complete, the proctoscope will be slowly withdrawn out through the anus. The entire procedure may be completed in 15 to 30 minutes. Post-procedure care. After the procedure, you may experience temporary discomfort in the rectal and anal region, but it should not interfere with returning to routine activities soon after the procedure. There may also be slight bleeding or blood in the stools if a polyp has been excised. These symptoms should go away in a few days. Risks. Although a proctoscopy is a very safe procedure, there is a minimal risk of injury to the inner lining of the rectum or anus, infection, bleeding. You should talk to your doctor regarding your specific risks before undergoing the procedure. Summary. A proctoscopy is done to visually examine the inner lining of your lower intestine and anus. It can cause slight discomfort, but is sometimes necessary to accurately diagnose certain diseases, enabling early treatment and better outcomes for the patient.